Order. I call the Secretary of State, Sajid Javid, to make a statement. Secretary of State.
Mr. Speaker, with permission, I'd like to make a statement on the pandemic and the roadmap to freedom. Freedom is in our sights once again, thanks to the protective wall of this country's vaccination programme and the huge advances we've made in getting this virus under control. Yesterday, I stood at this dispatch box and I set out the details of what Step 4 in our roadmap will mean for this nation. After the arduous 18 months that we've all endured, it was so wonderful to describe a world where we can no longer have to count the number of people that we're meeting, where theatres and stadiums are busting with people once again, and where care home residents are able to see their loved ones without restrictions. Now, of course, Mr. Speaker, I understand that some people are cautious about the idea of easing restrictions, but we must balance the risks. The risks of a virus that has diminished but not defeated, against the risks of keeping these restrictions and the health, social and economic hardship that we know they bring. This pandemic is far from over, and we will continue to proceed with caution. But we're increasingly confident that our plan is working and that we can soon begin a new chapter based on the foundations of personal responsibility and common sense rather than the blunt instrument of rules and regulations. Now today, Mr. Speaker, I'd like to provide an update on another area where we'll be able to ease restrictions, the rules on self-isolation. Self-isolation has played a critical role in helping us to get this virus under control by denying the virus the human contact that it needs to spread. And I'm so grateful to the many, many people right across the UK who have selflessly done their duty, making sacrifices so they can help keep the virus at bay. Even though we've done everything in our power to support the people who've had to self-isolate, and yesterday we announced that we'll be extending financial support until September, I'm fully aware of how difficult it has been. But we can take hope from the fact that science has shown us a solution, just as it's done so many times in our fight against this virus. And that solution is our vaccine, which we know offers huge protection. The latest data from Public Health England shows that our vaccination programme has saved over 27,000 lives and has prevented over 7 million people from getting COVID-19. And it shows that both doses of COVID-19 vaccine can reduce symptomatic infection by almost 80%. That protective wall, because that's what it is, a protective wall, it means that the odds have shifted in our favour and we can look afresh at many of the measures that we've had to put in place. Now, this is especially important when almost 2/3 of adults, that's 64%, have had both doses of a vaccine and so have got the maximum protection that the vaccine can offer. As a result, we will soon be able to take a risk-based approach that recognises the huge benefits that the vaccines provide both to people who get the jab and to their loved ones too. So, Mr. Speaker, from the 16th of August, when even more people will have the protection of both doses and when modelling suggests the risks from the virus will be even lower, anyone who's a close contact of a positive case will no longer have to self-isolate if they have been fully vaccinated. If someone gets their second dose just before or just after the 16th of August, they'll need to wait 2 weeks, after which their second jab can take effect and give them these new freedoms. So this will allow the vaccine time to build up the maximum possible protection, those 2 weeks. Now, as we make this change, we'll be drawing on the huge capacity we've built for testing and sequencing and advising close contacts who are fully vaccinated to take a PCR test as soon as possible so they can get certainty about their condition. And of course, anyone that tests positive will have to self-isolate whether they have had the jab or not. This new approach means that we can manage the virus in a way that's proportionate to the pandemic while maintaining the freedoms that are so important to us all. As honourable members will be aware, we're not currently offering vaccines to most people under the age of 18. So we've thought carefully about how we can make sure that young people get the life experiences that are so important to their development, while at the same time we're keeping them safe from this deadly virus. So in line with the approach for adults, anyone under the age of 18 who is a close contact of a positive case will no longer have to self-isolate. Instead, they'll be given advice about whether they should get tested, dependent on their age, and will need to self-isolate only if they test positive. These measures will also come into force on the 16th of August, ahead of the autumn school term. Now, I know that people will have questions, colleagues in the House will have questions about these changes and other questions around Step 4 on our roadmap and how it impacts schools and colleges. And my right honourable friend, the Education Secretary, will be updating the House immediately after my statement. We're also looking at the self-isolation rules for international travel so that we can remove the need for fully vaccinated arrivals to isolate when they return from an amber list country. And the Transport Secretary will be providing an update to the House later this week. Mr. Speaker, step by step, jab by jab, we're replacing the temporary protection of the restrictions with the long-term protection of the vaccine, so we can restore the freedoms which we cherish and the experiences that mean so much to us all. Let's all play our part to protect ourselves and to protect others as we enter these crucial few weeks, so that in this battle between the vaccine and the virus, the vaccine will prevail. I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth.
Thank you, Mr. Speaker, and I thank the Secretary of State for advance sight of his statement. Now, this morning, the Secretary of State was warning that he expects infections to hit 100,000 a day. So could he confirm if he is saying that will be the peak, and when will we hit it on his expectations? And can he confirm that with infections running at 100,000 a day, that will translate into around 5,000 people a day developing long-term chronic illness, long COVID? So what will the long COVID waiting list look like by the end of the summer? Now, he justifies allowing infections to climb by pointing to the weakened link between hospitalisations and deaths, and that we are building a protective wall. But of course, the wall is only half built. And we know from outbreaks in Israel and research that the Delta variant can be transmitted through fully vaccinated people, even if they don't get sick. And indeed, data in the last 24 hours or so from the Ministry of Health from Israel points to the Pfizer vaccine being just 64% effective at stopping symptomatic and asymptomatic transmission of the Delta variant. So sadly, being double jabbed means you are still a risk to others. And yet he's releasing controls on transmissions at the time when infections are rising, and then hospitalisations will rise as well, given we know what he's doing. So can he tell us what are the percentage of ICU beds and general and acute beds that will need to be occupied before, in his view, wider NHS care is compromised? Because we've heard him in the last week or so tell us that he wants to unlock because he rightly wants to focus on the monumental NHS backlog. But the rising hospital admissions that are baked into the plan, into the path that he has chosen, will mean operations cancelled, treatments delayed, and waiting times increasing. So will he now be clear with patients waiting longer and at risk of permanent disability that the increase in admissions to hospital will mean that they have to wait longer, and what is his assessment of the waiting list, and what will it hit by the end of the summer? Now, I understand the rationale for his announcement today, but I've got to tell him again that the biggest barrier to an effective isolation policy hasn't been the inconvenience, but the lack of financial incentive to stay home. And if we are going to live with this virus, The days of people soldiering on when unwell are over. Sick pay is vital to infection control. Will he please now fix it? Now, getting back to normal, which we all want to do, depends on people feeling safe. So does he appreciate that those who are immunocompromised or for whom the vaccination is less effective will have their freedoms curtailed by ditching masks on public transport? Blood Cancer UK yesterday warned that people with blood cancer will feel like their freedoms have been taken away when mask wearing lifts. What's his message to those with blood cancer? And it's not good enough to simply say travel or go to the shops at less busy times. Now, of course, he understands the importance of masks because I've now read his pandemic paper from Harvard that he likes to refer to, and he praises the use of masks in this paper. But he also warns in this paper that changing course on policy making is an essential feature of good policy making. And he goes on to say, yet politicians find it hard because of the tendency for decisions to become psychologically and emotionally anchored. Well, I agree with him, and I hope he still agrees with himself as well. So let's have a U-turn on mask wearing. Yes, let's have freedom, but not a high-risk free-for-all. Keep masks for now, fix sick pay, and let's unlock in a safe and sustainable way.
Mr. Speaker, let me turn to the right honourable gentleman's questions. First of all, he asked about infections, and as I said yesterday from this dispatch box, that we do expect for the time being infections to continue rising for the reasons I set out yesterday. By July the 19th, the point when we enter into step 4, the advice that we receive and the modelling suggests that it could be as high as 50,000, to double what they are now on a daily basis. And as the right honourable gentleman said, that beyond that, that we believe they will continue rising as the modelling goes out further. It's less certain, but they could go as high as 100,000. I've been very upfront about that. But what I've also been very clear about, the reason that we can make the decisions that we've made and set out yesterday, and the decision I just announced today on self-isolation rules for those that are double vaccinated if they come into contact with someone that is infected. The reason we can do this is because of the vaccine. The vaccine has been our wall of defence. Jab by jab, brick by brick, we have been building a defence against this virus. And the vaccine, whilst no one can say at this point that the link between cases and hospitalisation has been definitively broken, there's not enough evidence for that. What there is enough evidence for is to show us that the link between cases and hospitalisation and deaths has been severely weakened. And the honourable gentleman has asked about how many hospitalisations there have been or there may be. What I can tell him, I think will help demonstrate how this link has been severely weakened, is that at the moment we have in the last 24 hours approximately 27,000 reported new infections, and the total number of hospital in England with COVID-19, total number of people is just under 2,000. And the last time we had infections at that level, we were certainly above 20,000. And so that is a demonstration of how much the link has been weakened. And in making sure that it stays that way, we of course want to see more and more people getting vaccinated. We've announced a booster program that will start in September to make sure that immunity that comes from the vaccine remains. And the honourable gentleman also talked about non-COVID health problems, and he's right to raise that. A number of honourable members raised that, and I would like him to just try and understand that one of the reasons we have so many people that wanted to go to the NHS with non-COVID health problems, such as cancer and heart disease and mental health problems, but they were prevented, was because of the restrictions that we had in place, and how that prevented and how that impacted. Those restrictions caused many of those problems. If the honourable gentleman thinks about the mental health problems that have been caused, for example, by these restrictions. And so if we want to start dealing with those non-COVID health problems, then we have to start easing and moving away from these restrictions because of the protection the vaccine has provided us. And he, as the shadow health secretary, he should be just as concerned as I am about non-COVID health problems as he is with COVID health problems. And then the right honourable gentleman also asked me about the immunosuppressed, and again, he and other colleagues that have raised it, they're absolutely right to raise this issue. The vaccines are there to protect everyone, and including many of those people that are immunosuppressed that can take vaccines, but also for those who can't take vaccines, the fact that the rest of us do helps protect them, and we would want to see them take the same precautions that they would usually take in winter, for example, in trying to protect themselves against colds and flus and other viruses. And also I would encourage people to make sure they're in contact with their GP to see what other measures they might be able to take, what other precautions. And then lastly, Mr. Speaker, the honourable gentleman asked me about masks. He referred to a paper that I authored before I took this position. But he should understand, it's a strange question for him to ask. There is a role for masks in dealing with a pandemic, in particularly when you have a pandemic with no wall of defence against that pandemic. When you have a vaccine, and when that vaccine works, and when you've got the best vaccine rollout programme in the world, then you need to start moving away from these restrictions, including on masks.
The Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. One of those other illnesses, apart from COVID, that has been very badly affected by the pandemic is cancer. And my right honourable friend will know that last year 40,000 fewer people started cancer treatment, which will sadly lead to a number of preventable deaths. So will he be looking at the workforce required to deal with the cancer backlog? Will he also look at the capital requirements of many hospitals, including in my own area, the Royal Surrey County Hospital, trying to build a cancer institute, but many of my honourable friends and honourable members will have similar stories. And can I make him a bold and generous offer to come in front of the Select Committee in September to talk about those plans? He can come for a couple of hours, but we do up to 7 hours, should he so wish.
Mr. Speaker, my right honourable friend is absolutely right to raise the issues of cancer, and of course it is a huge priority for this government. I've just mentioned, Mr. Speaker, earlier that how sadly, because of the rules that we've had in place now for well over a year, there are many people that would have come forward to the NHS with cancer or suspected cancer, and they have not been seen, and that has really built up a terrible problem, and that is an absolute priority for me to tackle with workforce, with capital, and of course I look forward to coming and sitting in front of his Select Committee. I'm not sure about the 7 hours. I'd hope he'll be a bit more lenient on me than that, but I do look forward to it.
We now go to SNP spokesperson Martin Day. Martin.
Thank you, Mr. Speaker. Given that this government has repeatedly got things wrong on COVID, from the timing of lockdowns, which allowed the Kent variant to spread, the lack of border controls, which allowed the Delta variant into the UK, the delay on red listing of India, and now we have cases of the Delta variant surging while millions of people are still to be fully vaccinated and over 1 million are already living with long COVID, many will be concerned that the UK government is actively trying to snatch defeat from the jaws of a vaccine victory. What confidence can the public have that the latest round of measures, abandoning all restrictions, is not another reckless gamble in the face of an increasing transmission? In a poll by New Scientist, a majority of disease experts said that some form of mask wearing would be required until 2022, and others thought 2023 or later. Was the correct time to lift mask requirements? Then agreed with the government's position of ending the requirements this year. Can the Minister, for the sake of clarity and honesty, confirm that the UK government has stopped listening to the science on its COVID policy? Tragically, we have 150,000 people dead already, and the Prime Minister has said we must reconcile ourselves, sadly, to more deaths from COVID. So perhaps the Secretary can enlighten us as to how many more deaths the UK government thinks are acceptable.
Mr. Speaker, The honourable gentleman refers to the announcement we made around masks yesterday about moving away from rules and regulations to guidance and personal responsibility, and he's asking, how can we make such a decision? And the answer is the vaccine. The vaccine is working. We have more people vaccinated than any other large country in the world, thanks to the work of the NHS and the volunteers and everyone else involved, including, of course, in Scotland too. And that has weakened the link between cases, hospitalisation and deaths. And these decisions have been informed by the science. Contrary to what the honourable gentleman said, they've been informed by the science. The science is working.
For withdrawn, shall we go to Layla Moran? Layla.
Thank you, Mr. Speaker. The Secretary of State said in his statement that he was grateful to the many people across the UK who have selflessly done their duty. We all are. Well, last week, a friend of an NHS intensive care doctor emailed me in despair. The doctor contracted COVID-19 on Christmas Eve while doing her duty in hospital and has been unable to work since, as COVID then developed into long COVID. Now, HR have issued her with papers to file for statutory sick pay at the job centre, and she stands to lose her salary entirely. Surely this is completely unacceptable and an insult to NHS workers' sacrifices during the pandemic. Does the Secretary of State believe this is fair? I hope he doesn't. And if not, will he look into this and similar cases urgently so that the frontline staff, the heroes of this pandemic, receive the proper financial support they need while they recover?
Mr. Speaker, I'm pleased the Honourable Lady has raised this issue. First of all, my own personal thanks to the doctor in her constituency that she's just referred to, and to the many other doctors and clinicians for everything that they've done for the country and they continue to do throughout this pandemic. She's raised the issue of the particular doctor she's referred to. Obviously, I'm not aware of the details, but if she writes to me, I would certainly respond to her and look at it carefully.
David Green.
Thank you, Mr. Speaker. We all recognise that the tremendous success of the vaccine programme has changed everything, and my right honourable friend has made that point eloquently again this morning. But it's also clear from the recent daily figures that take-up appears to be falling. Can my right honourable friend explain why that's happening and what he's doing to make sure that as many people get vaccinated fully as fast as possible?
Yeah, Mr. Speaker, what I can tell my right honourable friend is that, first of all, in terms of take-up, compared to any other large country, it's the best in the world. That said, we of course would like to see even better take-up. At the moment, 4/5 of adults have had at least one jab, and 3/5 have had 2 jabs. We are seeing many vaccine centres move into sort of walk-in vaccine centres. I visited the one at St Thomas's myself just last week, and that has certainly encouraged more people to come forward. And also, yesterday I announced that we are shortening the gap between the first dose and the second dose for all under 40s to 8 weeks, and I think that will help as well. So we continue to push take-up, but every time this is raised in Parliament, it's a good thing. There's an opportunity for all of us as parliamentarians to ask our constituents to come forward, take up the vaccine and help build up that wall of defence.
Mr. Speaker, I thank the Secretary of State for his statement today and for all that he and his staff in the NHS have done on behalf of us all. I recognise, as the Secretary of State has said, that there must be a risk-free approach in place and welcome that. But can the Secretary of State outline what steps his department are taking to meet the psychological needs of young people with cancer to ensure that they can access timely, high-quality support regardless of the COVID statistics and variants, which has seen their treatment delayed, causing additional mental health strain? Thank you.
Mr. Speaker, the honourable gentleman is right to point out that there's no risk-free way forward. The whole world with this pandemic, it's unprecedented, and leaders across the world are having to balance up risks and take the approach that they think is right. And he's also right to raise the challenges created by this pandemic and our response to it that are not directly linked to COVID itself. The mental health increase that we've seen across the nation, including in Northern Ireland. We have provided much more funding for mental health, but we do need a long-term sustainable plan to deal with mental health challenges that have sadly increased.
Dr. Andrew Mercer.
Thank you, Mr. Speaker. I very much welcome the statement of my right honourable friend to his place. It emerges that AstraZeneca vaccine made in India, particularly batches 4120, Z0012 and 3, may not be recognised by the European Medicines Agency, despite of course being recognised by the MHRA. That has implications for the digital COVID certificate that will enable many constituents to be able to travel to Europe this summer. Can the Secretary of State clarify negotiations with Europe about this, and also say whether regulatory bodies in other jurisdictions, notably the FDA, are taking a similar line as the EMA is?
Mr. Speaker, what I can tell my honourable friend is that the AstraZeneca type vaccine being used in India is, I think it's referred to as Covishield. We have not used Covishield in the UK, and we are in intensive discussions with our European friends to make sure that they have the facts on hand and they can respond accordingly.
Let's go to Debbie Abrahams. Debbie.
Mr. Speaker, today's Health Foundation COVID report adds to evidence from Professor Sir Michael Marmot on the UK's high and unequal COVID death toll. It shows that the UK has not only suffered high levels of COVID mortality, the second highest excess deaths for working age people in Europe, but that people of colour and disabled people were 5 and 6 times respectively more likely to die than their white counterparts, as well as non-disabled counterparts. On top of this, those in poverty were nearly 4 times more likely to die from COVID than more affluent groups. So following my question to the Health Secretary yesterday, when I asked, is the government committed to levelling up or not, I'm asking when will they implement the Sir Michael Marmot's and the Health Foundation's recommendation to address these inequalities and build back fairer?
Mr. Speaker, I am looking closely at those recommendations. I want to look at the expert advice of everyone out there that's providing good, sensible advice about how we can come together and tackle this pandemic. And the Honourable Lady is right to point out that the pandemic sadly has been disproportionate in certain communities and its impact, including sadly with disabled people, people from ethnic minorities. That's true not just in the UK, I think it's true across the world. And we do need to work out a plan to deal with that, and also in the future, if there was ever a future pandemic, to make sure that we've learnt the lessons.
Thank you, Mr. Speaker. Clearly, our protection against further waves of the virus depends on uptake of the vaccines. Will my right honourable friend look at how the daily infection, admission and death statistics can be broken down by age group and by vaccination status so that everybody can see the benefits of vaccination for themselves and for others?
Yes, Mr. Speaker, the vaccines are our wall of protection. That is what is allowing us to make the decisions that we have to restore our freedoms and continue down that road. And I think providing more information, more detail on the take-up, especially by age group and locality, can be helpful.
Let's go to Tulip Sadiq. Tulip.
Thank you, Mr. Speaker. The flu season we've just been through was the mildest on record, thanks in no small part to the fact that we've all been wearing masks to protect against coronavirus. Public Health England has warned that we could see a flu surge in winter, as we haven't had much recent exposure and therefore immunity to other respiratory viruses. What is the Secretary of State doing to prepare for this? And does he agree that we should keep masks compulsory in public transport to keep COVID cases down and prepare for flu season?
Mr. Speaker, I think the policy on masks is the one we set out yesterday is the right policy, but the Honourable Lady is right to raise the concerns around flu this coming winter for all the reasons that she said. She asked what we're doing about it. Well, one of the things that we are doing about it, and by no means all, is that when we recently announced that we plan to have a COVID vaccine booster program in September, starting with the more vulnerable cohorts, our plan, based on the advice of JCVI, is also simultaneously offer the flu vaccine, which will mean that the take-up of the flu vaccine should be at record highs.
Thank
Thank you, Mr. Speaker, and can I welcome my right honourable friend's statement. One of the things that I get contacted by in an increasing number is access to GP appointments, with many constituents still struggling to go and see their GP face-to-face. And we know the impact that will have on early diagnosis and treating other illnesses. So could I ask what steps the department is taking to encourage and support GPs see patients face-to-face, which will help address many of those other challenges?
Yes, Mr. Speaker, it is essential, as my honourable friend says, that we get GP access back to normal. I think we can all understand why during this pandemic GPs have had to also do other jobs like help us get the vaccines, that they haven't been available in the normal way because of social distancing rules and other reasons. But I think gradually we are starting to see things going back towards normal. I think the changes that were announced yesterday will help with that. But also as the vaccine programme, which will continue for a while as we set out, as that settles down and we get more people dedicated to that, we can release GPs from some of those duties, and I think all of that put together will help.
Thank you, Mr. Speaker. The Secretary of State has already acknowledged the importance of dealing with the mental health problems that we've seen arising in this pandemic. And it's now urgent that that's addressed. So when will the government publish a clear statement on where Public Health England's vital public mental health and suicide prevention rule fit? Where will it sit in the new arrangements for our national public health system?
Mr. Speaker, the honourable lady is absolutely right to draw attention to this. One of the worst outcomes of all the restrictions we've necessarily had to have during the pandemic is there's been a significant rise in depression and many other public health problems, and we do need to start making that much more of a priority and tackling that now that we can move past what I hope is the worst of this pandemic. And I do want to come forward as quickly as I can with a new plan on mental health to set out what more we can do, both to clear the sort of backlog of cases, as it were, because we do need to put more effort and resources into that, but also looking forward about what more we can do, both through investment in skills, but also investment in capital.
Dr. Jamie Wallace. Jamie.
Thank you, Mr. Speaker. Can I thank my right honourable friend for this statement? Many constituents are asking me about the role booster vaccines will have in ensuring we don't have to go back into lockdown at a future date. Does my right honourable friend agree that providing additional booster jabs to the most vulnerable and all those over 50 will strengthen the protection and gains made by our current vaccine programme?
Yes, Mr. Speaker, I do agree with my honourable friend. The vaccine programme, that is our wall of protection, and every jab is building that wall higher. And as immunity wears off, we do need to make sure that people get a boost of that with a third jab. And as we've announced, that programme of boosting will begin with the most vulnerable cohorts in September.
Thank you, Mr. Speaker, and thank you for your indulgence allowing me to acknowledge the passing of Father Sam Swami from COVID last night. He is a humanitarian Jesuit priest who has been held in custody in India since October of last year, and I hope the House will join me in expressing our condolences to all who knew him. With regards to the statement today, there's a fundamental weakness to the Secretary of State's comments. The COVID virus did not get the memo and has not read his statement. And whilst vaccines are really important, if he wants to build a ring of defence around the continued spread of this virus, then surveillance is absolutely key. Last week I was promised evidence from Porton Down supporting the continued use of intravenous flow devices across the country. That information has not been passed to me. I also asked for the MHRA's letter recommending the extension of the exceptional usage authorisation. Again, that has not been forthcoming. When can I expect to receive this very important information?
Mr. Speaker, can I first associate myself with the honourable gentleman's expression of condolences, and turning to his substantive question. I'm not fully aware of the information that he has requested, so I have noted it now, and I will look into it and write to him.
Let's go to Gagan Mahindra. Gagan.
Thank you, Mr. Speaker. Can I welcome the statement from the Secretary of State and take this opportunity to welcome him to his place? Does my right honourable friend agree that the UK's portfolio of 517 million vaccine doses is evidence of the world-leading effort of this Conservative government in securing our routes out of this pandemic, allowing restrictions to be lifted?
Mr. Speaker, I agree absolutely with my honourable friend. I think it is fair to say our effort on vaccines as a country has been world leading. It is the best certainly in Europe in terms of number of people that have received the vaccine. It is the biggest and largest of any of the large countries, and that is down to the efforts of so many people, especially the scientists, the vaccine task force, and all the NHS workers, the doctors, the nurses, the volunteers, and it is a group effort, and it is something I think when we look back ultimately at this pandemic will be one of the things that we will know has saved so many lives.
Thank you, Mr. Speaker. Some experts are warning that easing COVID restrictions too quickly could contribute to the emergence of a new, more dangerous variant which may well be resistant to the vaccine. Can the Secretary of State inform the House of any contingency planning by his department or the UK Government about how the UK Government will cope in the event of such an alarming eventuality?
Mr. Speaker, the Honourable Lady is right to raise the risk that absolutely exists. This pandemic is not over of new variants. We've seen the impact of variants already, and no one knows what's going to happen. And of course, reasonable experts will have different views on this. In terms of the measures that we're taking, I'll point to a couple. We are keeping border controls in place. Yes, we are making some proportionate and balanced changes, but border controls are staying in place. We are keeping the test, track and isolate policy in place. Again, some sensible changes being made, but through that policy and the huge amount of tests that will still be done with our genome sequencing program being the best in the world, the largest in the world, it will allow us to detect any changes in the virus sooner than perhaps other countries. And then lastly, the team, both in my department, in Public Health England, the Chief Medical Officer, they're very much aware of this issue. It's not just an issue for us about new variants, it's an issue around the world, and we'll continue to work with our international partners.
Let's go to Henry Smith. Henry.
Thank you very much, Mr. Speaker. The UK's world-leading COVID-19 vaccination programme has been phenomenal, but unfortunately there are some immunosuppressed and immunocompromised, such as people with blood cancer, for whom the efficacy of the vaccine isn't nearly as effective. Can I have a commitment from my right honourable friend, the Health Secretary, that those who fall into that category will be properly informed and advised by the NHS as to how to protect themselves better?
Yes, Mr. Speaker, I can give my honourable friend that assurance, and he's absolutely right to raise this. And as we go forward with our plans and develop those plans, we are absolutely thinking about all those more vulnerable cohorts and the impact that it may have on them. And that is why when we set out the details of Step 4 regarding those that are immunosuppressed, there will be new guidance, and it will be something that GPs can use in working with those patients.
Nirals.
Thank you very much, Mr. Speaker. It's clear from comments made by the Chief Medical Officer, the Prime Minister and the Secretary of State over the last 24 hours that it is their view that it is better to have a third wave of COVID now than it is in the winter when the NHS is struggling. So could the Secretary of State please confirm explicitly whether that is the policy aim of the government? And if so, could he confirm how many excess deaths and additional cases of long COVID officials estimate that third wave will result in?
Mr. Speaker, no one wants another wave of COVID cases, and as the Honourable Lady would have heard, what is different this time, as we do see, sadly, cases rise, is the vaccine. The link between the case numbers and hospitalisation numbers has been severely weakened, as I've set out in the House, to the House in quite some detail, and that is what matters.
Sir David.
My right honourable friend's appointment as Health Secretary and his sensible statement today further easing restrictions. But following on from previous points of colleagues, would my right honourable friend confirm to Southend residents that the booster vaccine will be available this winter and that enough centres will remain open to efficiently administer it?
Mr. Speaker, I'm very happy to confirm that to my right honourable friend that the booster programme, which will start in September, we still have to get the final advice from JCVI on exactly how it's going to work, but it will be throughout the United Kingdom, and that of course includes his constituents in Southend.
Catherine West.
Speaker, parents in my constituency have been in touch regarding ventilation in their children's school. What advice will health officials give to the DfE about putting ventilation into schools and paying for extra measures, which might mean that children can stay in school longer without the fear of transmission of COVID, and that staff will be protected as well?
Mr. Speaker, another very good question, and the Education Secretary will be speaking right after me about some of the changes that we're making and how it will affect schools and school settings. And when it comes to ventilation, there has been, during the course of this pandemic, more funding to schools to make certain adjustments, and I think that kind of support will continue, but also I think some of the measures that we're announcing today will help with schools and school children.
Thank you, Mr. Speaker. May I start by welcoming my right honourable friend's statement. Earlier today, I spoke with the fantastic Chief Executive of one of our local NHS trusts in Stoke-on-Trent, Tracy Bullock, who oversees the Royal Stoke University Hospital. Tracy's told me there has been a significant increase in emergency department attendances above those usually seen in winter. So can my right honourable friend outline what additional resources can be given to help our NHS get on top of this, because winter is coming?
Mr. Speaker, my honourable friend will know that the reason that across the country we've seen an increase in demand for A&E is because many people haven't been able to go forward to their GPs in the usual way, and quite understandably, when a problem they have gets to a point which in normal circumstances it should not have had to reach, they go to A&E. And that is what I mean, Mr. Speaker, when I talked earlier at this dispatch box about the backlog of cases. I've mentioned yesterday we believe that some 7 million people that would have, in normal circumstances, come forward to the NHS, either through their GP or otherwise, that did not because of the rules and restrictions around the pandemic. And now, as we ease those restrictions, that's going to make a big difference.
Let's go to Florence Eshelmomi. Florence.
Thank you, Mr. Speaker. Over a quarter of my Vauxhall constituents are aged between 20 and 29. And many of them have not had a chance to come forward for their second vaccine. And obviously this lockdown will ease again in 2 weeks' time. The Secretary of State has this morning confirmed that numbers are expected to go after July the 19th. And he will be aware that it's still the case that a number of young people, 1 in 8, are still vaccine hesitancy. We know that there's no link between cases and hospitalisation, and that link isn't breaking. And young people are fearful of getting long COVID. Can the Minister inform the House what specific resources are being made available through the NHS for those suffering with long COVID?
Well, Mr. Speaker, I mean, first of all, throughout this pandemic, the government has made, I think, over £90 billion more available to deal with the consequences of the pandemic, and much of that has gone to the NHS and to other parts of the healthcare system, and that is helping in every aspect, but including with those sadly suffering with long COVID. In terms of younger people, the Honourable Lady will know that first of all, younger people are less affected. They are affected, of course, by this virus. No one can pretend otherwise, but they're less affected, less impacted by older people in their communities, and that's why that's been the priority in vaccination programs. But now, with the July 19th date, one of the reasons that date was set is that it allows everyone, every adult, to get their first jab, and also the reason I announced the decision yesterday, which was to shorten the time period from 12 weeks to 8 weeks between jabs, was that some more people, including all the younger people that she's referred to, can get the full protection of a double dose by September.
Hammond.
Thank you, Mr. Speaker. Can I thank my right honourable friend for his statement today? And he will obviously know there is the normal winter preparedness programme just about to start. Could he confirm whether or not he will examine the medical evidence for vaccinating people under the age COVID-19 as part of this year's programme, and what extra measures he might be putting in place with social care and discharge, so that the beds that normally the pressure on beds normally increases, will be taken care of this winter.
Yes, Mr. Speaker, my honourable friend is absolutely right to raise the normal pressure that comes in winter, and as we look at this winter, because of the measures that we had for the pandemic, it does mean there's less immunity for flu and other viruses that tend to come around in winter, and so we are actively making plans for that. There were plans already in the department when I arrived, and I'm reviewing those plans, and it's something that will be a priority.
Matt Weston.
Thank you, Mr. Speaker. The Secretary of State quite rightly last week stated that he was looking at the numbers very carefully immediately after being appointed. He'll have looked at Japan and Korea, no doubt. Well, he'll have seen that the death rates are something like 2% or 5% of the UK death rate. Case rates are currently 8 or 9 per 100,000 in Korea and Japan. Yet they are still wearing masks, mandating to wear masks, certainly in Korea. What does the Secretary of State think, in the light of that, we should be doing? Because clearly they're having success.
Mr. Speaker, we all know that the impact of this terrible virus has been very different across the world. The honourable gentleman has talked about countries in the Far East. The impact if you look at in South America or India or in Europe, it's very different. And I don't think you can simply draw a conclusion that the reason for that difference is the policy on masks. The primary reason we were able to announce what we did yesterday in terms of the step 4 measures is the vaccine. And if the honourable gentleman looks at the countries he mentioned, particularly Japan, he'll see that their vaccination rates are a lot lower than the rates that we have, and that will partly explain why they may be taking a different approach on how they're tackling the vaccine, the pandemic at this point.
Thank you, Mr. Speaker. Can I congratulate my right honourable friend on his new role, and I warmly welcome his statements about the importance of addressing non-COVID health issues. Sadly, for the last 17 months, our children have been not seen and not heard, and I know from my own children and those of my constituents the devastating impact that lockdowns have had on the well-being of our children and young people. So can my right honourable friend set out what measures he is taking as we return to normal to focus on the physical and mental health of our young people and make sure that the anxiety and the physical inactivity of the pandemic is not leaving permanent scars?
My honourable friend is absolutely right to raise this, Mr. Speaker, and sadly, because of the necessary measures that we've had to take, the impact on children has been immense in the negative ways that she's just set out. And she will know, just from my own research that I did before coming back into government, we've seen, for example, a huge rise in reports of child abuse. And the reporting, for example, to the NSPCC's Childline has rocketed during the course of the pandemic, and that is a direct cause of children not being in school, not having enough people to report that kind of activity to, and so we need to absolutely respond to that. And in terms of the measures, what I hope and what I know, and the Education Secretary will have more to say about this in a moment, the measures that we've already announced between yesterday and the measures today, I think will make a dramatic difference to children's well-being.
Let's go to Charlotte Littles. Charlotte.
Thank you, Mr. Speaker. The pandemic is not over, and learning to live with the virus means putting in place measures to reduce risk. Flamefast, based in Woolston Grange in Warrington North, manufactures CO2 monitors, which alongside measures such as air filtration and improved ventilation, can help to dramatically reduce the risk of indoor transmission of the virus. So why has the Secretary of State ignored calls from the Labour Party to put in place measures such as air filtration, improved ventilation and CO2 monitoring to reduce the risk in indoor confined spaces, particularly in hospitals and care homes for the most vulnerable in our communities, which could help to save lives and to give a vital boost to our manufacturing sectors?
Mr. Speaker, I think it's not right for the Honourable Lady to suggest that the government has ignored the need to combat this virus with better air filtration, with better ventilation. A lot of the funding the government has provided during the course of this pandemic, so for example, extra funding to care home providers, has been there precisely to introduce and help fund some of these measures.
Thank you, Mr. Speaker, and I welcome my right honourable friend to his new place. I know that he will share the view of many of my constituents in West Berkshire that we must do all we can to avoid another national lockdown. In the event that the vaccine efficacy should falter as we head into the winter months, say because of a new variant, could he set out what extra steps his department is taking to ensure that this winter won't be a repeat of last?
Mr. Speaker, what I can tell my honourable friend is that one of the measures, just one that we are taking, is that we do have, we have a huge number of tests that take place here, over 500,000 a day, and that does give us a certain insight into how this virus is changing, if it is. And the genome sequencing resources that we have are the best in the world. We do almost half of the genome sequencing in the world, and that is fed directly to our scientists and our world-leading vaccine program and taken into account as we develop new vaccines. And the Honourable Lady knows about the booster program. I think the booster program will continue into next year, and who knows how long, but every time we have a booster, we will be doing everything we can to take into account changes in the virus itself.
Let's go to Sir Tony Lloyd. Tony.
And thank you, Mr. Speaker. The Health Secretary has already referred to the pressures on our GPs and our hospitals from non-COVID patients, and that, of course, is real. Most health professionals, doctors, nurses and others, have been double jabbed and regularly use at least the lateral flow test to ensure that they're not infected with COVID. But one of the local hospitals that affects my constituency, Fairfield, tells me that there are something like 30% of doctors who were not available recently because they'd been pinged, they'd come into contact, not surprisingly, with somebody with COVID. Not because they found they were infected, but because they then had to go and quarantine for that 10-day period. We do risk, Mr. Speaker, a build-up of cases which will increase the number of times our medical professionals are likely to find themselves pinged. Could the Secretary of State have a look at this and see if there's some way, at least to medical staff, of bringing forward that August date?
Mr. Speaker, the right honourable gentleman has raised this issue of understanding people that are pinged, so to speak, that if, by having come into contact with an infected person, they do have to self-isolate. The announcement that I've made today will clearly make a huge difference to everyone that is pinged in such a way, including all those fantastic people that work in our health service, the doctors, the nurses and others. And as I've said, it will come into force from August the 16th. We did think carefully about whether we could do it earlier than that, and it's a fair question, but the reason we decided not to was based on the best public health advice, was that by August the 16th, there'll be many more people, even more than now, that are double jabbed, and that extra layer of protection makes us more comfortable to stick to this August the 16th date.
Thank you, Mr. Speaker, and I welcome the Secretary of State's statement. Primary care has shouldered the brunt of the vaccine deployment, and many GP surgeries in Stoke-on-Trent South are not yet back at full capacity with general appointments. A number of my constituents have raised the difficulties of getting to see their GP, so will my right honourable friend do all he can to ensure primary care services are able to fully recover?
Well said.
Yes, absolutely, Mr. Speaker. I can give my honourable friend that assurance, as well as the extra resources we're putting in. Even if you think about the measures that I've announced today about self-isolation and no need to self-isolate if you have if you've been in contact with an infected person but been double vaccinated, that will help across the board, and certainly that includes our NHS and our primary care providers.
I now suspend in the House for 3 minutes to enable necessary arrangements to be made for the next business. Order.